Welcome to part 2 on our video series of understanding your shoulder pain. In this video, we're going to talk about exercises that are beginning to focus on increasing the strength of your mid-back as well as getting some mobility and some range of motion in your shoulder while also getting some blood flow that will help with pain, hopefully get you moving a little bit better. So exercise number 1 is called the shoulder blade squeeze or the SCAP set. And all we're doing is you're going to pull your shoulder blades down and together, trying to contract the muscles in the middle of your back to pull your shoulder blades together and pull your shoulder blades slightly down, limiting the amount of activation you get of your upper trap. So you don't want your shoulders to go upwards or elevate. And all we're trying to do is doing 100%ers where you really pull those together tight and relax, and then 10 or 20%ers where you just slightly pull those muscles together to get a little contraction. And exercise 2 is the supine or laying flat on your back rotator cuff movements in order to help get some blood flow and hopefully make you feel better while being able to move that shoulder a little bit more. The 4 different motions that we're going to be doing is our arm's going to start straight up. We're going to focus initially on pulling those shoulder blades slightly down and back, so we're still concentrated shoulder blade position. Number 1, we're going above head as far as we can go. And we're going down by our side, constantly focus on that shoulder blade. You're going to do that for 10 reps. Number 2 is we're going side to side. You're going to also do that 10 reps. Again, let your shoulder blade move a little bit out to the outside when you're going across, and then you're going to force it back down as you come in. You can do that 10 times. Number 3 is a ceiling punch or serratus punch, and all we're doing is reaching up as far as we can go, and then letting that shoulder blade pop back down into that slot or slide back down. Good. And the last one is external rotation, which we can either do right by our side or out 90 degrees. And all we're going to do is still focusing on shoulder blade, and then we're just rotating in and out. And you're focused on keeping that shoulder blade in that position as we go through this motion. And you can do it here or out at 90 degrees. Same concept. So thanks for watching part 2. In part 3 and beyond, we're going to begin to use some manual therapy techniques that you can do on your own and hopefully to help you start feeling better. As well, we're going to teach you some self-tests that you can do on your shoulder to check for some pain and talk about sleep and some other healthy habits for your shoulder.